Let's go ahead and get started. Welcome to Greenville. My name is Brian Floyd. I'm the Executive Vice President at Vidant Medical Center. On behalf of my colleagues at Vidant Health and at the Brody School of Medicine, we want to welcome you and thank you so much for being with us today for what we believe to be the first of many conversations that we will have as a community. And today we have a lot of people here with us from various groups, and I'd like to make sure if we're going to have a conversation, we have an understanding of who's with us in the room today. So if we can, when I call a group that you belong to, if you would, please raise your hand so that we can recognize you and the role that you have here with us today. So do we have any federally elected officials here with us today? All right. How about state elected officials? All right. Are there any local government officials, mayors or commissioners, etc.? Public health officials? Healthcare leaders? That would be the Vidant Health people. It's appropriate for you to... or those that would like to be healthcare leaders. We're taking nominations. Anyone been a patient? Anyone have family? There we go. So, the reason we ask the question is everyone is a part of this, and whether you're a patient, whether you have a role that as an elected official or a member of the healthcare delivery team, we all have a role in the conversation we're going to have today, and so your perspective is quite important. The topic of healthcare and the changes in our industry are both a local issue and a social issue, certainly a national issue. But particularly here in Greenville and in eastern North Carolina, healthcare, as it is defined today, contributes to the quality of life of our community through health and healing of the sick, certainly, and the delivery of advanced technologies, but also the delivery of education. This education that's provided by a teaching program, School of Medicine, School of Nursing, allied health professions, and the cultural impact to our communities that come when there are physicians and pharmacists and nurses and other healthcare professionals that come to our community to participate. And in those ways, we enhance the quality of life through the healthcare delivery system here, but we also do so through the economy. Vidant Health produces about $2.4 billion of economic stimulus to eastern North Carolina. That alone is a part of the mission and an important part of what we do here at Vidant Health. You'll hear from our Chief Executive Officer, Dr. Herman, in a few moments, and also later in the day by Dr. Cunningham, the Dean of the Brody School of Medicine. And there are many others in the room that serve at Vidant Medical Center, part of our community, a major part of our community, but one that's often probably overlooked in its impact. 99 percentile. 99% of the United States hospitals are substantially smaller than this hospital is, even though we're in a town and a community of 80,000 people. It's grown from just a few beds in a county hospital setting to what is now nearly 1,000 beds right here in Greenville, North Carolina. Through the leadership of a community years ago who envisioned a healthcare enterprise that would both educate workers, bring physicians into a needed and underserved region, we now have developed quite a system that is providing for the state's largest admitting hospital, with more than 50,000 admissions this year. We'll have 120,000 patients in our emergency facilities just in Greenville alone. We will do more than 18,000 surgeries here in Greenville alone in our hospital setting. It's a tremendous growth in such a short amount of time of an infrastructure that is incredibly complex and large, a system that is growing to fulfill the needs of eastern North Carolina. Did you know that Vidant Medical Center is the third largest hospital in the United States for inter-facility transfers, meaning patients going from one hospital to a higher level of care at another hospital? We do that more than all but 2 hospitals in the United States. 60% of the patients in our hospital locally are from around eastern North Carolina, not Pitt and Greene counties, just to signify the growth. And of course, our medical school as a partner has been fulfilling its mission of producing primary care physicians. 50% of the physicians that are trained at Brody School of Medicine stay in North Carolina, and 30% of those will stay in Eastern North Carolina and have been for some time. These are huge parts of the mission which began years ago. You and I, as citizens, though, of Eastern North Carolina, are the beneficiaries of this growing healthcare system that has enhanced the quality of life of our communities. And so why are we having a conversation about this then? That's because the world is changing. The system exists in an industry where it's unaffordable for those who consume the services. So this system has been subsidized at a national level. Those subsidies have become unsustainable at a national level, which then affects what we do at a local level and how this industry is shaped over time. If we're large consumers and we are a large aggregator of healthcare services in Eastern North Carolina, and those subsidies and the economy that's associated with that, wouldn't it stand to reason that as this industry changes, we have a disproportionate change associated with it, experienced here locally and experienced in Eastern North Carolina? So this transition, this change of the world of healthcare delivery at a national level is part of our local level change as well. And it's a change that requires everyone to be part of it. Years ago, no one would have believed we would have all the infrastructure that we have today created by visionary people at the time who participated in a conversation about what could be. And so we're here again today to participate in another conversation about what can be, given the state of change and given the future of healthcare. You were invited to be here today, and you were invited for a reason, because your opinion and your perspective matters greatly to the conversation, and the actions that you take and the conversations you have outside of this room matter greatly to our ability to create change and to create a bright future for our communities. But your perspective matters only if we hear it and only if you participate. And we need you to do so today, and we want to make sure you have a common frame of understanding, that we discuss the issues, that you have a chance to ask questions from experts, many of whom are here in the room, about the changing world of healthcare delivery and how that impacts us locally, so that you and I can work together to create the future of our healthcare delivery system. The next part of this that I want to mention, in this advanced world of healthcare and all that we have in robotics and technology and all that, something my 8-year-old had to explain to me this morning, which is that a pound sign, formerly known as a pound sign, and number sign is now a hashtag. So we have a live Twitter feed that'll be on these screens today, and we want you to use it by using hashtag JoinVH. I have no idea what will happen when you do that, but somehow it involves these screens on both sides of the room, and someone will answer the phone for you, I guess. I don't know. So my kid will answer because he now has this information. So we want you to enjoy the day. We want you to take part in conversations at your table. I hope that you will take a moment, introduce each other at the table. As a matter of fact, why don't we do that now? If you don't know the people sitting around you, take a moment, introduce yourselves to your table so that you can have a conversation as we go forward. As we like to say, simmer down, simmer down. We want you to create some introductions, not lasting friendships here, and life experiences at the table. Next, what I'd like to do is introduce the Chief Executive Officer of Vidant Health, Dr. David Herman. Dr. David Herman is President and CEO of Vitan Health, which includes 8 hospitals and more than 70 ambulatory clinics across eastern North Carolina. Prior to his appointment with us here, he served for 23 years at the Mayo Clinic in Rochester, Minnesota, where he was chair of the Clinical Practice Committee and a member of the Board of Directors for the Mayo Clinic Health System and a member of the Mayo Clinic Management Team. Dr. Herman received his medical degree from the Mayo Medical School and his ophthalmology residency at the Mayo School of Graduate Medical Education and the National Eye Institute in Bethesda, Maryland. He also earned a master's degree in medical management from the University of Texas in Dallas. Dr. Herman serves on several committees, among them the Board of North Carolina Chamber, the American Board of Ophthalmology, and is Board of Trustees member for the Ronald McDonald House Charities. I've grown to enjoy working with Dr. Herman. I consider him among the brightest people I've ever met. That would include Dr. Toshlag and perhaps brighter than Dr. Chitwood. Don't tell him I said that. Dr. Herman has done a fantastic job as our CEO, and it's a privilege to welcome him here today to speak to you.